look at all of this stuff. Okay, that's two. All right, playing with these filters, guys. Sorry, trying to get more light in here. Anyhow, okay, thank you guys for joining. It is, what day is it? Wednesday, 12:30-ish. I'm in the middle of patients, but absolutely wanted to stop. Sometimes my headspace, I like to keep it like on patient care and not divert it at all, but this was something I felt like we needed to talk about. So I don't know if you guys caught the news, but yesterday, I believe the guidelines came out from the U.S. Task Force for Prevention, and they were talking about breast cancer screening. Now, breast cancer has been a topic of conversation for a really long period of time, and really is something that needs discussion, needs attention. So, super excited about all of that. But here's the issue: the recommendations were confusing, they were conflicting. Because they came out and advised people like me that are doing family practice and seeing the whole family and seeing women day in and day out to recommend mammograms after 40 to every other year versus the every 2 to 3 years, which were the recommendations from 2016. And after 50 to every year, it did highlight the importance of acknowledging things like dense breasts, which we've been talking about, right, for a really long period of time, and how important it is to think about dense breasts, evaluate dense breasts, and not just take it as a breast issue, but an overall detox and estrogen metabolism issue. So that part it was good that it came out from there. But then you've got the American Cancer Society and you've got the American Radiology Society saying, hey, wait, we were saying to do mammograms after 40 every year and after 50 every year. So now what is you, the patient, or me even, right? I had my own breast scare a year or so ago. What are we supposed to do? So this is where we get into the importance of really looking at the whole patient. These guidelines are helpful, but we really need to be looking even earlier than 40 and looking for hormone patterns like estrogen dominance. Now, we've talked about estrogen dominance before. Remember, that's all about how your body takes estrogen, breaks it down, and moves it through. You can catch that in your teens, your 20s, your 30s, and at so many different points. You don't have to wait till 40 for that. And I think what we've got wrong, kind of conventionally, is that we are waiting for these ages to look at these markers when we really should be looking far, far earlier. So one way to enter this conversation is like, okay, mammograms are important, especially if you have a family history or a personal history of breast cancer, or you have a history of dense breasts or breast calcifications, any of those type of things, or definitely if you find a lump, then do those mammograms early. I don't love the mammogram because it's a torture device, and the reason they moved the recommendations to begin with was because they were getting a ton of false positives and doing a lot of unnecessary procedures. So that was the reason it was moved to begin with. Now they're saying, hey, between 40 and 49, the incidence of breast cancer has risen. It's increased by about 2 to 3%. So how are we going to catch those women? What are we going to do? Here's what I suggest. Now, yes, mammograms are important. Ultrasounds are even better. MRIs, I feel like, are even more effective. When I was going through my own health journey, it was like, get the mammogram, then go do the ultrasound, then I had another appointment to do an MRI, then I had to come back and do a biopsy. It was just so jagged and took so long. And as a medical person, it took me a while to get all those appointments done. I can't imagine what that experience is like for everybody else. So what is not happening in any of these conversations is, first of all, screening for estrogen dominance and starting early. Secondly, highlighting the importance of early screening using tools that are non-radiologic in nature and don't impact the body as harshly maybe as some of the other scanning mechanisms do, something like a thermogram, and doing those consistently, year after year, so you can compare results and you can see where somebody might be shifting or changing. And again, looking at hormone levels and really understanding what's happening there. If you are storing estrone, you have high estrone levels, or you have high circulating estrogen levels, estradiol in particular, then we know you're at more risk for dense breasts, breast calcifications, all these other things that we talk about, and that in turn lead to a diagnosis down the road sometimes of breast cancer. Now, there are stages of dense breasts, and I'll post more videos and give you some breakdown on that so you can use it as a reference, but dense breasts actually get classified in 3 or 4 different categories. And so I think if you are getting into one of those higher categories of dense breast, then you need to be more aggressive with what imaging that you choose. But the most basic level, like everyone should be doing, I feel like all women should be doing it honestly at every age, is getting their hormones checked, getting a yearly thermogram, adding in the mammogram after 40, and adding in an ultrasound. I feel like mammogram and ultrasound, and maybe ultrasound itself, should really be the standard of care. And this is where the confusion starts to take place. So at the end of the day, what do? I think you have a conversation with your physician. You look at your risk factors. Those risk factors include how your body, based on genetics, your gut health, your nutrition, and your stress, how are you really breaking hormones down and moving them through your body? If any of those are not in the right place, then yes, indeed, you're at higher risk overall for something like a breast cancer diagnosis. Okay, so that's just on ages 40 to 49, the increasing incidence, the confusing recommendations that came out yesterday. I'm not sure they really helped the conversation at all. Let's talk about the other findings. The other findings were that Black women, in particular, were having a really hard time with breast cancer, a really high incidence of mortality amongst Black women. And a lot of talk again about screening Black women, getting them into this conversation, making sure they're staying on top of their health. Absolutely agree with all of that. But why are Black women in particular having this issue? I think they have a higher toxic load that no one's measuring, no one's jumping into and helping them to assess from an early age. And I think they also are having more of this gut liver dysfunction because oftentimes they're on a diet plan that is not matched in terms of their personal chemistry or personal health, and they don't have the access. Let's be honest, a lot of Black women don't have the access to care that is really digging in and looking at hormone levels and getting very deep in some of these conversations. So Black women are a high risk group now for breast cancer. So I did like that the recommendations brought that to attention and talked about the importance of bringing Black women, more and more Black women, into conversations around screening and around checking and all this other stuff. So that came out of this. We talked about dense breast as well, and how dense breast used to be just dismissed, like, oh, you have dense breast, no big deal. Now there's more acknowledgement. I mean, I've been doing this for almost 15 years and I've been talking about this the whole time. Now finally there's more acknowledgement around, hey, if you've got dense breast, we really do need to dig into this and try to understand what's happening with you. So that part is a win too, from these recommendations from the U.S. Task Force for Prevention. So I'm curious if you guys have dealt with breast cancer screenings, what you think of them, what has worked for you, what has not worked for you. Feel free to share or send us your comments or your questions. We can take a few questions in just a second. But then I do have to get back to patients. But definitely, I think this is an important thing for all of us to be talking about over the next few weeks, and really thinking about what it means to screen for breast cancer, where our energy needs to go. And I would argue that these ages of 40 in today's environment are still too late. We need to be starting earlier and earlier, looking at hormone levels, understanding what the level of inflammation is in the body, incorporating thermogram, utilizing something like ultrasound more, and then adding in things like mammograms and MRIs and all this other stuff. I feel like this conversation is starting too late, and we're not going to change the trajectory of breast cancer or any cancer, honestly, for that reason, until we really think about how we are looking at the whole body. All right, last thought, and then we'll take questions. Now, there is a huge, and I saw some comments come up about stress, there is a huge connection to breast cancer and trauma or stress in women. So much so, here's the Chinese medicine explanation why. We hold stress in the liver, right? That's where anger is stored. That's where a lot of our strongest emotions are stored. What is the liver responsible for doing? The Eastern theory is that when you burden the liver with a lot of stress and a lot of cortisol and a lot of anger, then the liver can't do its job. It can't break things down effectively. It can't get rid of hormones. It can't get rid of toxins. And you're in this sort of loop of, having higher and higher levels of bad estrogen or dirty hormones, as we've been calling them. So trauma, I can literally probably put a stopwatch by it. If there is severe trauma that is not sort of methodically released, or you don't take the time to nurture yourself and to release those emotions, literally 18 months later, I'm often dealing with a woman who is facing a diagnosis that they did not expect. So if you are going through something, whatever it is, just a reminder that the body is connected. Meridian theory and energy theory says we hold all of this in the liver. The liver runs directly on the meridian that runs right through our breast, okay? And that in turn can trigger all kinds of issues with your hormones and your hormone balance and how you detox things and how things move through. So hopefully that helps or doesn't confuse you further. Again, all of this is sort of in response to the study that came out yesterday from the U.S. Task Force for Prevention. All right, I'm going to stop there. We can take just a couple of questions, and then I got to run out of here.
Okay, the first question we have, how can we catch estrogen dominance in your 20s and 30s?
Okay, great question, and I sort of indirectly addressed that. Catching estrogen dominance in your 20s and 30s is so important. I wish I had done this in my 20s and 30s. Check your hormone levels. That's the number one. I know you're so tired of me saying this, but and if you need kind of a guide to check your hormone levels, please go on my website. Go to drtaz.com. We've got a hormone guide on there. You just have to put your email in and you can get it, and there's a more detailed one in the shop as well, so use that as your guide. But specifically, everybody, even my 15-year-old, we should be checking an estrone and estradiol. Check the androgens, because some of the excess estrogen gets converted over into androgens, but you want to understand the full picture of hormones. Again, that's drtaz.com, and you have multiple options there in the shop for checking your hormones and understanding what's going on with your hormones in particular.
Okay, and how big of a part do genetics play in breast cancer?
I love this question. Okay, genetics and breast cancer, let's talk about it. So we know about the BRCA gene. In practice, we'll test COMT, which is another gene that's related to how we metabolize estrogen. There's a whole family of the CYP1B1 genetics that are responsible for estrogen metabolism, and then of course there's the MTHFR family. So there's all this alphabet soup essentially when it comes to estrogen and estrogen metabolism. We do have to take those seriously, but here's how we need to understand them. The genes dictate chemistry and function, but chemistry and function can be changed. So again, we've got this conventional approach of you have this gene, take this stuff out. How about you have this gene, let's shift your chemistry. Let's shift it in the right direction. And all of that is possible. But if you're getting stonewalled or blocked and it's not happening, then that changes strategy, right? So that's when you think about, okay, I've got BRCA. Do I need a mastectomy? I've got this gene. Do I need that? But remember, just because you take parts out doesn't change the chemistry of the body. That estrogen dominance will still be there unless you're taking everything out, and then you're going into menopause at a very young age that has its own health consequences. So all of this has to be thought through pretty strategically.
Awesome. And what can we do to lower estrogen dominance? Any supplements you recommend?
I love that question. So it starts with food and gut, right? So clean up your diet, get rid of the fast food, get rid of the chemicals and the preservatives. That's probably the number one reason we're seeing so much estrogen dominance. It disrupts the entire hormone profile. So get that stuff out of your diet if you can. Follow an anti-inflammatory diet for sure. All of that is going to make a difference. So that's the first. The second is, yes, there are supplements that help. Fiber, first of all, helps to break up estrogen, the cruciferous vegetables, and then kind of mimicking that are the supplements. DIM is one, that's an enzyme that helps to break estrogen down. There is something called indole 3 carbinol, or I3C, that also helps to break estrogen down. And then we know that calcium glucarate, milk thistle, they support the liver and indirectly help to break estrogen down as well.
And then off of the DIM that you just mentioned, I've heard to only take DIM in my luteal phase. Is that true, or should I be taking it all the time if I'm estrogen dominant?
Okay, if you're estrogen dominant and still getting a period, you should take only a very small dose. I would say around 200, 300 milligrams of DIM days 1 through 14. You don't want to take it in the phase where your estrogen is going down. So take it in the beginning. If you're having more of an androgen issue, then yes, you could take it in the luteal phase. All right, we can do one more and then I gotta go. And look, we can continue to answer these questions. Join my Superwoman Circle where we'll do monthly Q&As and dive more deeply into all these different topics. I hope to see you guys there. That link is in my bio as well. And we'll be doing lives periodically, so save your questions for the next live also. All right, let's do one more.
Okay, final question.
Yes.
Is there a way you can tell if you have dense breasts without a mammogram?
Definitely. I think if your breasts are heavy and full and tender, like you're getting tender a lot, those are heavy, dense breasts. So yes, you can tell. If you don't feel that sense of fullness or tenderness, then you may not be dealing with dense breasts, but it's a good idea. I think if you're fuller, if they're feeling heavier, if you're feeling weighted by them, then those are things that might warn you that you're having dense breasts.
And that's it.
All right, thank you guys. We'll do more of these. Send me your questions, send me topics, and of course we dive deep into everything that you want to in the circle. Join my Superwoman Circle. The link is in my bio. We are doing our next coaching session. I think it's on a Sunday night, Sunday, May 21st. So see you guys there. Take care.